Welcome to the UK Made Easy podcast, where we help aspiring international medical graduates like yourself achieve their dreams of passing their PLAB 2 and practicing medicine in the UK. Hello and welcome to yet another episode of the UK Made Easy podcast. My name is Saif, and in this episode we're going to talk about vomiting in a pregnant woman and how such a case could possibly present in an OSCE scenario examination. Now, to start off, what are sickness and vomiting in pregnancy? Now, the most important thing is to remember that most pregnant women, they actually feel sick and vomit during early pregnancy. So in a way, it can be considered as a normal part of pregnancy, and it's often called morning sickness, even though the symptoms can occur at any time and not just in the morning. In most of the cases, symptoms are really mild to moderate. Feelings of sickness, nausea typically come and go, and they can last anywhere between 1 to 4 hours at a time. Now, in some cases, some women do experience severe symptoms and have frequent or longer bouts of vomiting, and we're going to talk about that later on throughout our discussion today. Now, another thing that is important to remember is that feeling of nausea and vomiting usually starts by the 9th week of pregnancy. And in 9 out of 10 women, those feelings or those symptoms are completely gone away by the time they reach the 16 weeks of pregnancy. It's also important to remember that it can be, even though it's a very common thing to happen with pregnancy, but it can impose challenges that are not easy to cope with. For example, it can interfere with a woman's life in terms of mood, in terms of work, in terms of home situations, and her ability to cope and care for the family. Even though we talked about the fact that this is a normal part or a normal symptom of pregnancy, especially early pregnancy, but like I said, it's a spectrum. Right? Now, it starts with what is known as normal, and at the end of the spectrum, we have something else called hyperemesis gravidarum. And it's very important to know what that is and how it could possibly present. Its incidence is very small. We're talking about 1 out of 100 pregnant women would experience such a phenomenon. And basically what it is that the sickness and vomiting are prolonged and are very severe, causing severe lack in fluids in the body, which is known as dehydration, and losing weight. It's very important to highlight that part, losing weight. It's very common when it comes to hyperemesis gravidarum. In addition to that, some of the other challenges or some of the other problems that hyperemesis gravidarum can cause is lack of vitamins, because these women are not able to eat, and for such reason, sometimes they go into starvation mode. It's very important also to remember that when it comes to hyperemesis gravidarum, admission is warranted to the hospital for intravenous fluids and other treatment. So as you can see, it can start with something that can be in most cases considered as normal, but it can develop into something else that requires admission. And thus, it's very important to be able to diagnose hyperemesis gravidarum. And for that, what we do is that we look for ketone bodies in the urine. And ketone, as you know, probably know from diabetes, right? It is one of the metabolites that occur in the body, right, in response to starvation mode, and it really does show in the urine, and it has a very distinctive smell as well. So it's very important to test the urine for ketone bodies just to rule out hyperemesis gravidarum. Want to put your PLAB 2 knowledge in action and receive detailed feedback about your strengths and areas of improvement? Order the UK Made Easy mock service, where we don't only tell you how you did, but actually provide you with pointers on how you can improve fast. Head over to www.ukmadeeasy.net/book-online. That is www.ukmadeeasy.net/book-online. Now, one of the questions that you could be asked, that you will possibly be asked in a scenario where a pregnant woman is referring to you for vomiting is that what causes sickness and vomiting in pregnancy? What causes the condition that I have, doctor, right? And the actual condition, like the mechanism, is not known to us, okay? But it's probably due to hormonal changes of pregnancy. But there are risk factors. And those risk factors include the fact if a woman is pregnant with a female baby or with twins. If that is her first pregnancy, That should be highlighted because, again, if it's a first pregnancy, there is a very good chance that she might still not know and she's just referring to you with vomiting. So it's very important to remember that one of the risk factors for the sickness and vomiting is the woman actually having her first pregnancy. Also, if the woman has previous history of motion sickness or family history of nausea and vomiting in previous pregnancies, which bring rise to another set of questions when it comes to past medical history. Did she suffer from motion sickness before? Does she have a family history of nausea and vomiting in previous pregnancies? These are some sort of questions that you could be throwing in if you are suspecting that we're dealing with a vomiting in a pregnant woman. Of course, if she has a history of migraines as well, that could be a risk factor for developing sickness and vomiting in pregnancy. If she did experience nausea when taking combined oral contraceptive pills, and if she is stressed or anxious about something, which again makes you think about asking about the current situation, what's happening on with her life, if she has any unusual stressors for the time being, because that could be a risk factor, and if she is a younger woman. So what kind of stood out for me from all those risk factors is the fact that if the woman is a younger woman, if it's her first pregnancy, she has a previous history of motion sickness, she's going under excessive stress. These are some of the things that you should be thinking about and you should be excluding when you suspect vomiting in a pregnant woman. Now, the other question that's very important to address at this point is that, does the sickness and vomiting affect my baby? And it's very important, and this is one of the questions where was actually very expected to be asked, and your answer should be that the effort of retching and vomiting does not harm the baby. So deliver reassurance at this point. It does not harm the baby. In fact, some studies have shown that having sickness and vomiting in early pregnancy is actually a good indication that the pregnancy is healthy and will have a successful outcome. No mechanism or no theoretical explanation has been given to that, but it's basically based on statistics. If the woman develops hyperemesis gravidarum and she became very ill with the lack of fluids, i.e. dehydration, and is not treated, that could impose serious problems on the baby in terms of having a low birth weight when they are being born. Okay, however, these speculations are not always correct because some women have had hyperemesis gravidarum and have managed to deliver a very healthy child. What are other causes of vomiting? Okay, so again, when it comes to a pregnant woman who's having vomiting, yes, you could be thinking about this is something normal and it could happen. As a matter of fact, it happens with many of the women and it's usually gone away by the 16th week of pregnancy. But because you are a safe doctor, you need to exclude more sinister reasons. And one of the things that really stands out is urinary tract infections. There are signs that you should be looking for, okay, and obviously investigations that you should be carrying out to rule out a UTI, urinary tract infections, to rule out gastroenteritis, for example, and to rule out jaundice. These are the main three things that you should be thinking about. So some of the signs that you should be looking for is very dark urine or the inability to pass urine for more than 8 hours, stomach pains, for example, high temperature, of course, headache, runny nose, yellow skin, severe weakness or feeling faint, blood in the vomit, and repeated unstoppable vomiting. These are the main signs and symptoms that you should be looking for, just to exclude other sinister reasons. Namely, we're talking about UTI, we're talking about jaundice and gastroenteritis. Now, the other question is, what sort of investigations do I need to carry out? And the investigation that you need to carry out at this point is checking urine for ketone bodies, just to rule out hyperemesis gravidarum. And in addition to the other investigations, including complete blood count, of course, maybe you'll do inflammatory markers just to rule out any sort of infections as well. These are some of the things that you should be doing, in addition to probably a urine analysis as well to exclude urinary tract infection. When it comes to the management now, we've already mentioned at this point that if you are suspecting hyperemesis gravidarum and it has been confirmed by the investigation, then this warrants admission because we need to replenish the fluid, and in addition to the use of other medications medications as well. But there are things that you can tell your patient if the condition is not as severe and it's normal vomiting that happens throughout pregnancy. And some of the things that you can tell your patient is the fact that if they eat small and frequent meals, it really can help. And the best foods at this point are foods high in carbohydrates, such as bread, crackers. And one of the things that it has been found to be of help is the fact that eating a plain or ginger biscuit 20 minutes before getting up is said to help many women. And when it comes to meals, remember that cold meals may be actually better for the nausea than hot meals because of the smell, because the smell can actually trigger the whole sensation of nausea. In addition to that, you can recommend ginger, because studies have shown that ginger tablets or syrup has been effective for relieving the feelings of sickness. However, care should be taken because the quality of ginger products varies and they're not closely regulated in the UK. So typically, before taking any ginger product, the woman should discuss with the pharmacist or the GP about the product that she has in mind. In addition to that, they should avoid triggers, and triggers can vary from one woman to another, but most common triggers are smells and emotional stress as well. Having lots to drink to avoid the lack of fluid in the body, and we should aim for at least 2 liters of fluids a day. And it's very important to remember that cold and sweet drinks can sometimes worsen the symptoms. In addition to that, rest, of course, having plenty of rest, plenty of sleep in early pregnancy, because being tired is actually thought to make the nausea and vomiting worse during pregnancy. On the more contemporary side of management or treatment, you can recommend acupuncture. Acupuncture does not involve the use of needles, only pressure at certain points, and it has been said to be of effect in some pregnant women. So, when an OSCE examination, the things that kind of stood out for me is that the fact that you need to rule out hyperemesis gravidarum, and you need to suspect that this is actually the case, that the vomiting is due to the pregnancy if the patient that is presenting to you is a younger woman, is having her first pregnancy. Maybe she has a previous history of migraines, previous history of motion sickness, or family history of nausea and vomiting during pregnancy. These are the main things that kind of stood out for me, and these are the main pointers that should point you in the direction that this vomiting is probably due to pregnancy. You need to make sure, because you are a safe doctor, to exclude hyperemesis gravidarum, and you do that by the ketones in the urine, and you need to exclude other sinister reasons, namely we're talking about UTI, gastroenteritis, and jaundice as well. I hope this has been helpful for you. If you would like to be notified about content that we push out, please subscribe to our channel on YouTube. And if you have any questions, feel free to comment on the video or send us our questions on our Facebook page, UK Made Easy. Thank you very much, and I'll see you in a future episode.